Across rural Missouri, hospitals are closing at an alarming rate, sending shock waves through communities and upending lives.
It's like a cafe, and then we sell local gifts.
Sitting in front of his downtown Boonville shop, Greg Hoffman says there's a lot to love about his town.
It's a great place to live. It's very quiet. Everybody knows everybody, of course.
But for Hoffman and the more than 8,000 others that live here, there's an uneasiness.
They just pulled out. They just left.
Because for the first time in more than 100 years,
we've got a pretty big hole.
There's no longer a hospital here.
To say that the closure was a surprise, yes. Yeah.
Mayor Ned Beach says everyone was blindsided when Pinnacle Regional closed their doors in January, taking with it 150 jobs and the town's sense of security.
You can't discount that. It's real. The feelings, the mistrust that it causes touches everybody.
The closest hospital, now a half-hour drive.
God forbid if something happens to me, my wife, or anybody in this town, and it's a life-death situation, 30 minutes might be too long.
Boonville's story isn't unique. Pinnacle Regional, now the 10th rural hospital to close in the state since 2014.
We know that a lot of rural hospitals are struggling financially.
At the Missouri Hospital Association,
we have a very analytical approach to it.
Dave Dillon is part of a group working to figure out why and how to triage the crisis.
One of the biggest challenges for small hospitals is that they have a much more limited number of patients coming through the front door.
And patients they do have are more likely to have Medicare or Medicaid or not have coverage at all.
All of that adds up to a significant financial challenge.
In Mexico, Missouri, there's still a hospital, but it's losing millions of dollars a year. And it started cutting services like pediatrics and obstetrics.
At this point, I think the real fear is losing the hospital entirely, not having that emergency care when you need it.
The OB services are no longer available. My doctor is no longer in Mexico anymore.
Stephanie Kulis is pregnant with triplets and now makes a 45-minute long drive to see her doctor. She'll take that same long drive when she goes into labor.
But yeah, the 45 minutes, especially if there's an emergency, can be scary, yeah.
Which could be the same distance everyone in town would face if Mexico joins the long list of Missouri cities that have lost their hospitals.
When you're talking about a 45-minute ride to get to emergency care, that can be the difference between life or death.
So what's being done to stop the bleeding? For one, there's an initiative petition that's circulating right now that would put Medicaid expansion on the November ballot. Hospital leaders say that would help, but there's no one right answer. And oftentimes, the struggles of hospitals points to a larger, looming crisis in rural America, where many small towns and communities are struggling to stay viable. In Kansas City, Matt Evans, KMBC 9 News.
The Missouri Hospital Association says Medicare for All wouldn't be the answer for rural hospitals. Those hospitals already lose money treating Medicare patients.
The association also believes abolishing the Affordable Care Act would be a bad decision. Instead, hospitals in Missouri hope our elected officials will build on the ACA to help shore up rural hospitals in the state.